Hello, this is Dr. Barr, and my practice is focused mostly on longevity and anti-aging and men's health. I'm in Orange County, and today I would like to talk about a condition that a lot of people don't talk about. It's not a new condition. It's called Peyronis Disease. I know this is a big name, but it's basically, in simple terms, for you all out there, it's a curved penis or an angulated penis. So Peyronis Disease, it's a condition where the curved penis is usually shown during erection. So during a flaccid time, the penis is not curved. And most men would have pain, and unfortunately also might suffer of a little bit of ED, shortening of the penis. It can affect the quality of life. And we have seen patients come in and normally not talking about it, maybe discussing ED in the practice, but then when we do a proper exam or do further history, we find out it's Peyronis disease. How common is it? Some studies say from 1 in 100, but more and more now we're finding research and publications that says about 8 out of 100 people have this condition, and with variable degree. So again, it is only noticeable during erection, and the reason this happens is really because of a scar happening in the tissues of the penis. So in simple explanation, the penis consists of a tube, a shaft, and the shaft has, maybe on both sides, think about it as a sponge forms on either side. These spongy tubes have blood vessels. Their vessels are arteries that can get engorged and compress the veins, so then the blood stays there. That creates the erection in that spongy space. That spongy space in the tube is covered by thicker layer called the fibrous tissue, or like the tunica. Okay, and the fibrous tissue over the time with trauma or some conditions that we're going to discuss right now might be thickened and create a scar. And when the scar happens on one side or one area, for example, if a male is injecting Trimix, okay, Trimix is an injection that men put into their shaft to create an erection before their intercourse. Multiple trauma in this area, or multiple trauma to the penis over age, usually it occurs after 40 most of the time, but it can happen at any age. This area would be traumatized, the fibrous tissue would become thickened, and the area that is thickened will not fill with blood supply. So the blood supply goes to one side and the other one cannot expand, so that creates the angulation, and it can be even to a sharp angle. So what are the symptoms of Peyronis disease? Symptoms are pretty much, you would feel a lump sometimes in the penis, on the side of the penis. Pain during erection, one issue that men would suffer from. Unfortunately, also ED. They're unsatisfied with the intercourse. The penis becomes shorter. It's difficult to insert the penis. And of course, this becomes an issue of lifestyle and affects, the patient in a drastic way. So who is more likely to get the Peyronis disease? So either men involved in vigorous sexual or non-sexual activities cause injury to the penis. Also, it can occur in connective tissue disease. It can happen in a family, or autoimmune disease that you would find in the family. Sometimes there's a history of Peyronis disease, or a contracture. Contracture is even in the hand. Sometimes that's an issue of autoimmune. Dupuytren's contracture. Older men, 40 usually is more common, or 45 and above. Usually that is where the age we see men with this condition. Diabetes and erectile dysfunction, and of course prostate cancer, especially after surgery, that can be an issue too. So two situations we deal with: either it's an acute and stable, or it becomes chronic and progressive. Acute and stable, usually 10% to 15%, it does not progress, and the patients do not have much problems, and there is some improvement of symptoms. However, up to 50% of the males will have issues, and it will progress and will become a problem. So the treatment for the acute phase, usually we recommend oral medications. We help things with erection, maybe like Viagra and other natural ingredients as well. Penile stretching is one, is like exercising the penis to try to do traction to reduce the fibrous tissue in that area. Of course, the common one that we do in the office is penile injection, and that's the P shot. And that is injecting the P shot in the area of the scar. And we usually use PRP or some medications for that. The chronic phase, again, penile tractions, the same treatment. P shot, which is another way of creating a resolution of the scar. And if it's progressive and there's no recovery from the P shot and no improvement, then surgery is the only situation that we can help reduce that, and we have to refer to a surgeon to cut this stricture or fibrous tissue. So again, most of the men will suffer of most of the time of ED issues. Up to 30 to 50% would have ED, and the question is ED the reason why the cause of Peyronis disease, or the egg or the chicken, basically, which started or caused the other? Non-surgical treatment, that's what we do, and we discussed this before in the P shot. So basically, it's a very simple procedure. You come to the office, the same day procedure. We numb your penis, and you don't feel anything. We inject the area with either collagenase, which is a Xiaflex, which is FDA approved medication that is an enzyme to resolve the scar. However, we're getting great results, and there's a lot of literature more about the P shot. And the P shot is really our male enhancement procedure that we do for men, and it is great because not only it can help with the Peyronis disease, but it enhances the erection, it's stronger and longer endurance, increases the blood supply for the penis, creates new blood vessels, increases satisfaction, and supports the erections and ejaculations. So it has more benefits, and of course some people do that for cosmetic reasons, for increasing the girth or the length of the penis. So it's the same day procedure under local anesthesia. We use PRP, which means we draw your blood. We discussed this in another YouTube program, and we extract that beautiful golden serum out of the blood. We spin it, and it has a lot of the healing and repairing tissue that we re-inject in the area of the scar, and that helps a lot with the healing. However, we also can use it as a filler. We put it in the areas where it enhances the sensation. We inject it in the areas, the spongy area, which will increase the circulation and create more blood supply. There's a lot of literature now that's out there, and we've treated so many patients with this condition, where it really helps with ED as well, especially with people failing the Viagra and Cialis and having more problems, not responding to Trimix and other medications. So I think it's a good start to learn about this condition. And this is a video for education and just making awareness out there for people to know that there is some treatment for that condition. And we encourage that you give us a call. We'll be happy to help and give you more advice and see if that's a procedure for you. Thank you so much for tuning in, and please send us comments for other topics that you might be interested in learning about. And our phone number is there if you would like to call the office and schedule a consult with us. Thank you so much.